This is FYI on your TV, brought to you by Hometown News. I'm Kathy Botham. I've got Debbie McIntyre with me. You're a public health nurse with our Leeds and Grenville Lanark District Health Unit. You were here last year as well, too, and we're going to talk about the same thing. January, we had a non-smoking week. In January, and we weren't able to get you here, but we know it's important, so we need to talk about this too. Sure. So we're going to talk about some myths and some facts about going along with trying to quit smoking too. So let's see here. Nicotine replacement therapy. What is that?
So nicotine replacement therapy is a medically approved way of getting nicotine into our bodies. Very helpful for people that are trying to quit. So there's a couple of different types. There's long-acting, which people know as the patch, and then there's the short-acting. They both really should be used in combination to have the best effect. But essentially what they do is they help you to manage withdrawal symptoms while you're trying to quit. So it replaces a small amount of nicotine that you would get from smoking cigarettes, so that you don't have that irritability, lack of being able to concentrate, low mood, all of that stuff that goes along with trying to quit.
So is that the spray? Is that the short-acting one?
Yes,
okay.
Yes. So there's a couple of different short-acting. So there's gum, there's lozenges, there's inhalers, there's now little mini lozenges, there's sprays. So yeah, and those are meant to be used when you have a craving for a cigarette. So the long-acting is the patch, put it on first thing in the morning when you get up. Just delivers a little bit of nicotine into our system all the time. And then there's those occasions where sometimes it's connected to habit, things that we do, where we just say, oh, I really need a cigarette right now.
I'm having my coffee, sort of thing.
Having my coffee,
Driving.
Just had a nice meal. First thing in the morning with that coffee is one of the biggest ones that we hear.
Yeah.
So putting that patch on and wearing it for 24 hours if you can, is ideal. Some people say that they have some vivid dreams with it and some difficulty sleeping. So if that happens, we say take the patch off at night. Don't worry about it. But I always talk to people about that too and say, if those vivid dreams are not really disruptive to you and they're not causing you any problems, just leave the patch on.
Enjoy.
Because ideally, ideally that's how it works best. And then you use that short-acting in those times where you are craving a cigarette, or I often will say in times where you're anticipating, where you know that you're going to want a cigarette, use that short-acting first. Then if you do decide you're going to light that cigarette, it's not going to be quite as enjoyable because your body's got some nicotine there.
Right.
So it helps to break those habits that we've connected.
Okay, so one of the myths is that nicotine replacement therapy does not work. Yeah. Can you tell us about that? Yeah,
so I mean, it works. It actually works quite well for a lot of people. It actually can double your chances of being able to quit because it manages that roller coaster of nicotine going into your body. Then as soon as you stop smoking your cigarette, your nicotine starts to drop. So then you smoke another cigarette to bring it back up. Kind of levels that out. One of the other things that we often find with people that say that the NRT doesn't work is that they're not using it under the direction of someone to help them figure out the proper dose, when to use it, how to use it. There's a lot of little pieces of things that are important there.
Okay.
So, and I would say to people, if you've tried it before and it didn't work, try it again. Give us a call too. We can help to give you some tips and tricks of things we've learned of ways to help it work better.
Okay, and another myth is the nicotine replacement therapy will not take the withdrawal symptoms away, but you say they will. Well,
it does. I mean, there's always still going to be a little bit of withdrawal. It doesn't take it all away, but it certainly does help to alleviate some of that. The first week or two when you're trying to quit is really the hardest, but after a day or two, if you're still finding those withdrawal symptoms are really difficult for you to manage, that's where we want you to connect back with us or your healthcare provider. Maybe we need to change the dose. Maybe we need to change how we're doing something.
Right, and it's okay to use like the patch plus the spray plus...
Absolutely. Absolutely. They're actually meant to be used in combination.
Okay, yeah.
And then the other thing that's really, really important, as I talked about too, is that behavioral piece. So changing kind of your habits, changing your routines, because if we don't break that, because a lot of smoking is connected to the things that we do.
Right.
So kind of those three things together.
Okay, now are these nicotine replacement therapies, are they expensive?
So they are expensive, but I think when you look at the cost financially of cigarettes, the cost to your health, price starts to look a little bit better. And the other good news about it is we do have programs here in Ontario that we can get free nicotine replacement therapy for people. So you can talk to your healthcare provider about that, give us a call. We can kind of help to guide you to help you access free nicotine replacement therapy. Our program right now, we're partnered with CAMH, so we can provide up to 26 weeks of free nicotine replacement.
Wow.
So,
wow. And do you usually have a good handle on the situation by then, or?
Yeah, most people
26
do.
weeks,
Most people do. But there has been some expansion to the program as well for people that we know are at high risk of relapse. So we can support with another additional 26 weeks. So there's some criteria around that. We can walk you through that. But it is not unusual for people to slip and start going back to smoking again. So one of the things we say, if that happens, give us a call back and let's get you back on track.
Yes.
You know, before one cigarette becomes 4, which becomes 12, which soon becomes 20.
Absolutely.
So, you know, that's okay. We almost expect relapse is pretty predictable, that people are going to go back to their old habits.
Okay, and I just thought of this question too. Can
Sure.
like somebody have the patch on and be doing this nicotine therapy? What happens if they have a cigarette?
Yeah, so there used to be a lot of information out there saying that if you have the patch on, take it off if you're going to smoke.
That's stressful in itself.
Yeah, but there is no evidence to support that. The most that might happen, so what we always say is leave the patch on. If you decide you're going to have a cigarette, again, like we talked about, try the short acting first. So that when you have the cigarette, it's not quite as enjoyable. And then don't smoke it right to the filter just because you've lit it, you know, put it out, put it aside. And then carry on. It's not the end of the world if you do have a little slip like that. The most that's going to happen is you're going to maybe not feel too well.
Yes.
So what we call nicotine toxicity. So it can happen.
There is such a thing then.
Oh, there
yes,
is.
okay.
There is. We've changed the language. It's not an overdose of nicotine because you really can't die from it. You're not going to feel too well. That can happen even if you smoke too many cigarettes in a row.
Yes.
So you feel nauseous, sweaty, a little bit of heart palpitations. So if that happens, you know, you can either take off the patch or just wait it out, and it will go away usually.
And that's a common myth too. People think that having a cigarette calms you down when really it doesn't.
Yeah.
Like physically.
Yeah. So oftentimes what I say with that is what actually probably calms you down about that is your body's been craving the nicotine. So then you've given your brain that nicotine, which calms your brain down. Because actually when we do smoke a cigarette, it actually does increase our heart rate. It increases our blood pressure. But sometimes the act of taking a break from what you're doing, going outside to have a cigarette, is actually what reduces your stress. Okay. So you can give us a call. We can talk about that too. There's lots of other ways to reduce your stress without having a cigarette.
Right. Now you are a certified tobacco educator.
Yeah.
Is that a newly designated position, or?
Yeah, so it's fairly new. I just wrote my exam in November. So you write an exam. Basically, what it designates is that I've had some special education around tobacco, education, prevention. It's for healthcare providers to show that we've learned a little bit of evidence-based stuff to help.
Okay. And you've been here last year. We talked about non-smoking week as well too. And last year we were talking about vaping as well too. Is that a good alternative, or? So
vaping it's a bit of a challenge right now in the fact that we just don't know enough. With cigarettes and other forms of tobacco, we have decades of information about it. Vaping's still new, so we really don't know all the health benefits. Right. There are a few things that I always say about vaping. One, if you're vaping and smoking combustible cigarettes, I want you to switch just to vape. Because we do know that the smoking of and lighting things on fire and breathing them into our lungs is not good. So we do consider vaping to be safer. The second thing is, if you don't smoke, don't start vaping. And some people will ask about using vape to quit.
I've heard many people say that, I'm vaping, I'm trying to quit smoking.
Yeah, so I think as long as, so it's not an approved way to quit. I'd far rather you use something like nicotine replacement or a prescription medication to quit. I have heard of people who have been able to quit, but it does require being very careful about it. And you also don't want to replace one habit with another. So if the intention of vaping is to quit smoking, it should also be to quit nicotine altogether.
Okay, okay.
Does that make
Yes,
sense?
Some of the vaping has got smelly stuff in it too, so that's an added, I would think, chemical or something.
Yeah. So, and that's what we just don't know yet.
Yes.
And we do, we do know that there are aerosols that are expelled when you breathe out. It's not just water vapor. There is aerosols there, and we're just not sure yet. So I think those are those main points. If you're going to vape, to quit combustible cigarettes, great,
Right.
with the intention that you're also going to quit the vape as well.
Okay.
Not just replace one habit with another. Because nicotine is not the dangerous part, it's the addicting part, or the part that creates the dependence.
That's right, that's right. Now, secondhand smoke too. It's just as bad too.
It could be.
Yes.
We're still finding, that's what we're still finding out. Like I said, decades of information about secondhand smoke from cigarettes, lots of it there.
Yeah.
We just don't have that kind of information yet for vaping. So.
Right, right. Now, quitting smoking and quitting vaping it's going to be one of the hardest things you ever do in your life too.
Yeah.
How do they get a hold of you? How do they get some more information?
Yeah, so we've been working very hard on kind of updating our website page, so you can check out our website at healthunit.org. You can give us a call at 1-800-660-5853, extension 2121. The other way you can reach us is we have an email address, and it's pretty easy, quit@healthunit.org. Give us a call wherever you are in your journey, even if you're not sure you want to quit. I'm also happy to help with nicotine replacement for people who are just trying to reduce the amount they're smoking.
Absolutely.
If a full quit's not in the cards for you and that's too much commitment, let's talk about how we can reduce.
And so often too, you may have a husband or a wife or a child that wants you to quit, but you're not ready yet. But you just need a little bit of maybe just lessen smoking, lessen the amount of cigarettes you smoke. Yeah.
And sometimes it can be just those small steps can be big wins, and can build your confidence to be able to say, you know what?
Yeah.
Maybe I can do this.
Absolutely, absolutely.
And like I say, we have had people that are calling us back now that were former clients, which is, I always think, is really encouraging, because that means that they know the program works. They've given us another call back to get back on track again, which is good.
Absolutely.
And that's what we want to be here for.
And so often you hear a parent say they're smokers, they don't want their children to smoke.
No, and that's what I say too. It's around role modeling.
Yes.
Same with vaping, role modeling those healthy choices and healthy behaviors for the next generation. And
we're role modeling. That's right.
Yeah.
That's right. That's right. Well, thank you very much for coming here again, Debbie. Debbie McIntyre, public health nurse and certified tobacco educator with our Leeds Grenville and Lanark District Health Unit. Thank you very much for coming here. Get a hold of you if you want to try quit smoking or even just lessen the habit.